Hi, I'm Dr. KB, and today we're going to talk about one of the most misunderstood, misdiagnosed, and flat out ignored causes of neuropathy, a cause most doctors completely overlook. Every year, millions of people walk into clinics complaining about burning feet, tingling fingers, numbness at night, electric shock sensations, balance issues, weakness, or that strange crawling feeling under the skin, and they walk out with pain pills, antidepressants, or vague advice like, "It's just nerve damage, take this and live with it." But what if the real cause of neuropathy wasn't even touched? What if the root issue stayed hidden simply because conventional medicine rarely looks for it? So here's the question I want you to answer for yourself as we go through this. If you've been struggling with neuropathy symptoms, what do you believe is actually causing it? And if you don't know, what do you need to finally get your life back from this relentless nerve pain? Let's dig into something that almost no one hears from their doctor. A little-known metabolic and dietary trigger that quietly destroys nerve function long before blood tests show anything abnormal. This overlooked factor has been mistaken for diabetic neuropathy, age-related nerve decline, vitamin deficiency, and even autoimmune disorders, yet it continues to slip under the radar because the standard medical playbook rarely questions the deeper patterns behind chronic inflammation and nerve degradation. Many people are told that neuropathy is just a complication of diabetes. But here's the twist. Tens of thousands of people with normal blood sugar, normal A1C, and no diagnosis of diabetes still develop neuropathy. Why? Because neuropathy can start years, even decades, before diabetes is officially diagnosed. That's the part that most doctors miss. They check a fasting glucose, see that it's normal, and assume there's no blood sugar problem. They don't realize that nerve tissue can be damaged by metabolic dysfunction long before lab numbers cross the threshold. So if you've been told your labs look fine, that does not automatically mean your nerves are fine. The nerves in your feet, hands, and legs are like electrical wires. They need stable metabolic fuel, high-quality nutrient building blocks, and protection from oxidative stress. If any of these factors fail, the nerves begin to misfire. You start noticing tingling while resting, or maybe a buzzing feeling when you get into bed. You shrug it off at first. Then weeks later, the tingling becomes burning. Then the burning becomes pain. Then the pain becomes numbness, which is the worst stage, because numbness means the nerves are losing function, not just overreacting. And while all this is happening, most routine doctor visits only look at surface symptoms. You get prescriptions instead of answers, labels instead of explanations, and temporary relief instead of genuine healing. That's the cycle I want to break today, because the little-known cause I'm talking about is something that affects metabolism, hormones, blood vessels, nerve insulation, and even mitochondrial function. It's something that slowly chips away at nerve health, even in people who eat healthy, exercise, and follow the advice they were told to trust. This root cause affects the integrity of the smallest nerves first, the ones in your feet and hands, and then moves deeper. And by the time the symptoms are obvious, the damage has already been happening silently for years. Many people think neuropathy is only caused by high blood sugar, but that's only part of the story. The real issue begins with insidious metabolic stress, chronic inflammation, and exposure to certain foods and chemicals that disrupt nerve signaling pathways. These triggers overload your body's ability to repair nerve tissue, leaving your nerves vulnerable. Yet most doctors are not trained to look at the metabolic ecosystem that surrounds neuropathy. They treat the pain instead of the process. What I want you to understand, and what we will go much deeper into, is that neuropathy is rarely a random event. Your body is giving you signals, warning signs, early alarms, long before the burning and numbness begin. The problem is that the medical system isn't trained to decode those warnings. They don't ask why the nerves are suffering. They only try to silence the symptoms. And here's the part that makes this little-known cause so dangerous. It doesn't show up on the common tests, not on standard blood work, not on basic metabolic panels, not on routine nerve conduction studies. It hides in your daily habits, your diet, your inflammatory load, your microvascular health, and your mitochondrial performance. You can have neuropathy even when everything looks normal on paper. But once you understand what's actually affecting your nerves, you can take control. You can stop the progression. You can reduce pain, restore sensation, and protect the nerves that are still healthy. You can rebuild your system from the inside out. That's what this entire video is about, uncovering the truth behind neuropathy that the majority of people never hear. And now that we've opened the door to the real root of the problem, let's shift into the next segment where we break down this hidden cause piece by piece, how it develops, how it destroys nerve tissue, and most importantly, how you can finally take back control. Now that we've opened the door to the truth behind neuropathy, let's go deeper into this little-known cause that slips past most doctors. The part that gets missed is this: neuropathy often begins with a chronic metabolic overload that silently damages the smallest blood vessels in the body long before blood sugar is ever flagged as abnormal. These tiny vessels, the ones feeding your nerves, are the first to suffer when your metabolism becomes unstable. And the number one driver of this microscopic deterioration is something almost nobody connects to nerve pain: long-term repeated spikes in insulin that never get diagnosed, never get discussed, and never get corrected. This is what we call chronic hidden hyperinsulinemia, and it is one of the most damaging, underdiagnosed metabolic problems of our time. It is often the true beginning of idiopathic neuropathy, the term doctors use when they have no idea what's causing your nerve damage. Instead of telling you they don't know, they label it with a fancy word that means they don't know. But hyperinsulinemia is rarely tested for, rarely talked about, and rarely brought up in conventional medical appointments. Yet it destroys nerve tissue from the inside out. Let me walk you through how this happens. When you regularly consume foods that cause large, rapid insulin spikes, especially ultra-processed grains, high fructose sweeteners, refined carbs, and seed oils, your insulin levels stay elevated for hours or even days. High insulin inflames the lining of your blood vessels, not the large arteries that show up on MRIs, but the microscopic capillaries that supply oxygen and nutrients to your peripheral nerves. The nerves in your feet and hands are far away from the core of your body. They depend heavily on these tiny capillaries to stay healthy. So when these vessels are inflamed, constricted, or damaged, the nerves begin starving, and a starving nerve becomes a dysfunctional nerve. That's when the tingling starts. At this early stage, you may feel odd sensations like buzzing, pricking, heat waves, or crawling feelings. These symptoms come and go. Most people ignore them. But this is the nerve begging for help. Most doctors assume these sensations are minor, unrelated, or due to stress. They almost never connect these early warning signs to damaged microvasculature caused by chronic high insulin. As the condition progresses, the nerve's protective myelin sheath begins to break down. Myelin is like the rubber coating around electrical wires. Without it, the electrical signals jump, misfire, or fail entirely. The burning pain you feel is actually a nerve trying to send a message through a damaged insulation layer. The numbness is a late-stage alarm. It means the nerve has lost so much support that it can no longer function properly. And the most frustrating part, you can go to your doctor with burning feet or numb hands. They'll test your glucose, they'll check your A1C, and when both come back normal, they'll tell you your neuropathy isn't metabolic. But here's the truth. You can have severe hyperinsulinemia with completely normal glucose levels. Your glucose number stays artificially normal because your insulin is working overtime behind the scenes. But that high insulin is also wrecking your blood vessels. And when blood flow is compromised, the nerves begin to malfunction. This is why neuropathy shows up years before a diabetes diagnosis, because insulin resistance always comes before high blood sugar. The medical system doesn't test insulin because it's not part of the standard panel. It's not routine, it's not required. And yet it's one of the most important markers for early neuropathy risk. This is why thousands of people walk out of doctors' offices every day with a bag of prescription nerve pills when what they actually need is a deep metabolic evaluation. So here's where this gets even more important. Hidden hyperinsulinemia doesn't exist in isolation. It comes packaged with chronic inflammation, oxidative stress, mitochondrial dysfunction, and the accumulation of damaging byproducts that affect nerve health. Mitochondria are the powerhouses inside your nerve cells. When they aren't working well, your nerves can't generate the energy required to send clean, consistent signals. That leads to misfires, pain, and sensory disturbances. And again, this is happening long before any lab markers look concerning. Another piece of this puzzle is something called glycation. When certain types of sugars and proteins bind together under chronic metabolic stress, they form sticky compounds called AGEs, advanced glycation end products. These accumulate in your nerves, your blood vessels, and even your skin. AGEs are like rust. They stiffen tissues, reduce flexibility, impair nerve conduction, and accelerate damage. And once again, this process is driven not by high glucose alone, but by the metabolic chaos created by insulin resistance. You may have been told neuropathy is genetic or age-related or random or inevitable. But the reality is that these metabolic factors account for a massive portion of nerve dysfunction. And the tragedy is that people suffer for years without anyone explaining to them what's actually happening inside their bodies. But once you see the real root of the problem, you can start changing the outcome. The body is not broken. The nerves are not doomed. The capillaries can heal. The inflammation can subside. The metabolic fire can be extinguished. And when that happens, the nerves often begin to recover. Sensation can return. Pain can diminish. Balance can improve. It doesn't happen overnight, but it does happen when you address the correct cause. Now that we've gone deep into what's driving this hidden neuropathy process, let's move into the next segment where we break down exactly how this metabolic overload begins, what daily habits make it worse, and the surprising lifestyle patterns that can trigger nerve damage even in people who think they're doing everything right. Now that we've broken open the truth about hidden metabolic overload and the silent rise of hyperinsulinemia, it's time to talk about how this problem starts in the real world. Because neuropathy isn't something that appears out of nowhere. It develops from daily habits, overlooked food choices, environmental factors, and subtle lifestyle patterns that build up over time. Most people don't recognize these triggers because they seem normal, they seem harmless, and in some cases they're even marketed as healthy. But when these habits stack up, they create the perfect storm for nerve damage. One of the biggest drivers behind this hidden neuropathy process is something shockingly simple: the constant grazing pattern that modern life encourages. People are eating from the moment they wake up until the moment they go to bed. A quick breakfast, a snack mid-morning, lunch, coffee with sugar in the afternoon, a protein bar, dinner, a little dessert, something before bed. It doesn't even feel like overeating, but every time you eat, your insulin rises. And when you eat 5, 6, or 7 times a day, your insulin never truly comes back down. That means your blood vessels and nerves are swimming in inflammation all day long. Your nerves were never designed to function in a high insulin environment. They thrive when insulin is low, steady, and only rises occasionally. But when insulin stays elevated, the smallest nerves, the sensory nerves that detect temperature, vibration, pressure, and pain, begin to malfunction. Many people experience the early stages of neuropathy as nighttime symptoms. That's because your body finally gets a break from food for the first time all day, and the nerves become more sensitive to the damage that's already been accumulating. This is why burning feet often start in the evening or when you lie down. The underlying inflammation has been building for years, but your daily eating schedule kept it hidden until your body finally quieted down. Another surprising cause is the excessive intake of processed carbohydrates labeled as healthy. Many people who develop neuropathy aren't binging on candy or soda. They're eating whole grain, cereals, energy bars, fruit smoothies, low-fat yogurt, granola, and wheat bread, foods that are marketed as clean and nutritious but are actually glucose bombs. These foods spike insulin even more aggressively than some junk foods. And over time, those high spikes trigger the exact metabolic pattern that slowly destroys your small nerve fibers. Then there are the seed oils, highly processed industrial oils like soybean, canola, corn, sunflower, and cottonseed oil. These oils are in almost every packaged food, every fast food meal, every restaurant dish, and every heart-healthy bottled dressing. They're rich in unstable omega-6 fatty acids that oxidize under heat and light. When these oxidized fats enter your bloodstream, they create free radicals that damage your mitochondria, the energy engines inside your nerve cells. Damaged mitochondria can't produce enough ATP, the fuel that allows nerves to fire properly. Low mitochondrial output is one of the earliest detectable signs of peripheral nerve dysfunction. Yet most people have no idea their cooking oil is quietly damaging their nerves meal after meal. Next comes chronic stress, something nearly everyone experiences, but almost no one connects to neuropathy. Stress raises cortisol. Cortisol increases glucose. And when glucose rises, insulin rises to compensate. But unlike food, stress can spike insulin even when you haven't eaten anything at all. Long-term cortisol elevation also interferes with nerve repair and reduces blood flow to your extremities. If you've ever noticed your neuropathy symptoms get worse during stressful periods, that's not a coincidence. Stress doesn't just affect your mood, it affects your nerves directly. Another overlooked trigger is poor sleep. Most people think sleep affects energy and mood, but it also affects your metabolic health. One night of poor sleep can cause insulin resistance. A week of poor sleep can mimic pre-diabetic blood sugar behavior. And months or years of poor sleep can dramatically worsen neuropathy risk. Nerves repair themselves mostly during deep sleep. If you aren't getting consistent deep sleep, the damage builds faster than your body can repair it. That means even small metabolic missteps can escalate into major nerve issues. And let's talk about deficiencies. Not the simple single nutrient kind you hear about in commercials, but functional deficiencies caused by poor absorption, poor gut health, and chronic inflammation. Many people are technically eating enough vitamins, but they aren't absorbing them. B vitamins, especially bone, B6, B9, and B12, are absolutely essential for nerve function. But inflammation reduces absorption. Medications reduce absorption. Gut issues reduce absorption. And hidden hyperinsulinemia interferes with the body's ability to use these nutrients effectively. So even if a blood test says your levels are normal, your nerves may still be starving for what they need. Another factor people rarely consider is physical inactivity, not the lack of intense workouts, but the lack of natural movement. If you sit for hours a day, circulation to your extremities drops drastically. Nerves rely on a steady delivery of oxygen and nutrients. When your muscles stay still, your blood flow stagnates and your nerves pay the price. Many people develop early neuropathy simply because their lifestyle doesn't include enough walking, stretching, or functional movement. And finally, environmental toxins, household chemicals, heavy metals, pesticides, artificial additives slowly accumulate in the body and increase oxidative stress. Your nerves are incredibly sensitive to toxins. They don't have the same protective barriers that your brain has. So repeated exposure to these chemicals over years can contribute to nerve degeneration. And because these toxins rarely show up on routine blood work, the connection between environmental exposure and neuropathy is almost always missed. All of these factors combine into a powerful force that pushes your metabolic system out of balance and places enormous pressure on your nerves. And the tragedy is that people experience the symptoms without ever understanding how their daily environment shaped the disease. But when you identify these hidden contributors, you can finally start removing the sources of damage. Now that we've explored the real-world triggers that quietly push the nervous system over the edge, the next segment will focus on what you can do about it, the realistic, evidence-based changes that can actually reverse nerve damage, restore sensation, and reduce burning pain. Now that we've uncovered the hidden metabolic triggers, the overlooked daily habits, and the food and lifestyle patterns that slowly push the nervous system toward dysfunction, it's time to talk about solutions, real solutions, not symptom masking medications, not short-term relief creams, not vague advice like eat healthier or take a vitamin. We're talking about the steps that actually allow nerves to heal, blood vessels to regenerate, mitochondria to regain strength, and inflammation to settle down so the body can repair what's been damaged. Let's start with the foundation, reversing hidden hyperinsulinemia. If high insulin is the quiet force damaging blood vessels and starving nerves, then lowering insulin is the first step to giving those nerves oxygen and nutrients again. And the most powerful way to lower chronically high insulin is to stop the constant eating cycle. Your body needs space between meals. It needs time without incoming glucose. It needs long, steady windows where insulin can fall low and stay low. When insulin drops, inflammation drops, blood flow improves. Mitochondria wake up, nerves start getting the support they've been missing for years. You don't have to starve yourself, you simply need to stop grazing. 3 meals a day. For some people, 2 meals a day. For others, 1 solid, nutrient-dense meal is enough. The point isn't to diet, the point is to give your insulin a break. You want your body to rediscover metabolic flexibility, the ability to burn fat instead of sugar, because when you burn fat, you create cleaner fuel for your nerves, stronger energy production, and a metabolic environment that allows healing instead of damage. Next is stabilizing your diet by removing the major inflammatory triggers. Start by eliminating sugar in all its forms. Table sugar, high fructose, corn syrup, sweetened drinks, flavored yogurts, energy bars, pastries, juices, anything that spikes insulin and floods the bloodstream with excess glucose. Sugar is one of the fastest ways to damage nerves. Then remove refined carbohydrates like wheat flour, cereals, crackers, pasta, granola, and processed breads. These foods convert into glucose almost instantly and hit your nerves just as hard as sugar does, but the most important food category to remove, especially for neuropathy, is seed oils. These oils destroy the omega-6 to omega-3 balance in your body and create oxidative stress that directly harms nerve cells. Swap them out for real traditional fats, butter, tallow, olive oil, avocado oil, or coconut oil. Your nerves need stable, anti-inflammatory fats to rebuild their protective myelin sheath. When you remove the industrial seed oils and replace them with real fats, people often notice their nerve symptoms calming down within weeks. The next pillar is nutrient density. Your nerves can't repair themselves without raw materials. That means prioritizing foods rich in B vitamins, omega-3 fatty acids, choline, and minerals like magnesium, potassium, and zinc. Real food always absorbs better than supplements because it comes packaged with the cofactors your body needs. Eggs, salmon, sardines, grass-fed beef, liver, leafy greens, and high-quality dairy provide the building blocks for nerve repair. Foods rich in bone and B12 are especially important because they support nerve signaling, myelin repair, and energy production. When people add nutrient-dense foods back into their diet after years of eating processed foods, their nerves finally get the nutrition they've been deprived of. Now let's talk about reducing inflammation. Chronic inflammatory load is one of the main barriers preventing nerve recovery. Reducing inflammation isn't just about diet, it's about lifestyle. It starts with sleep. Deep sleep is when nerve regeneration happens. If your sleep is shallow or interrupted, your nerves don't get repaired. A cool, dark room, consistent sleep schedule, limited late-night screen time, and magnesium before bed can significantly improve sleep quality over time. As your sleep improves, your insulin sensitivity improves, your inflammation lowers, and your nerves get a chance to heal. Stress reduction is another major component. Chronic stress is like pouring gasoline on metabolic dysfunction. It raises cortisol, which raises insulin, which further restricts blood flow to your nerves. Simple tools like controlled breathing, walking outdoors, sunlight exposure, journaling, or even spending time in silence can lower cortisol levels dramatically. Your body was not meant to exist in a constant fight or flight state. When you bring your nervous system back into balance, you free up energy for healing instead of survival. Movement is also essential. Not intense exercise, just movement. Walking increases circulation to your feet and toes. Gentle stretching improves nerve glide and blood flow. Even simple foot and ankle exercises can dramatically improve oxygen delivery to damaged nerves. When you move, you send a biological signal that says, these nerves are needed. Keep repairing them. Many people underestimate how powerful daily walking can be for neuropathy recovery. And then there's environmental detoxification, reducing exposure to household chemicals, artificial fragrances, harsh cleaning agents, pesticides, and heavy metals decreases the oxidative burden on your nerves. Your liver and kidneys can finally focus on clearing old toxins instead of fighting new ones every day. Over time, that reduction in oxidative stress allows your nerves to function more smoothly and repair at a faster rate. All of these changes work together, lowering insulin, reducing inflammation, increasing nutrient density, improving sleep, reducing stress, and rebuilding mitochondrial strength. When you combine them, something remarkable happens. Your body begins repairing the very nerves you thought were permanently damaged. People often notice tingling before sensation returns, then warmth, then improved balance, then less pain. Nerve healing is slow, but it is absolutely possible when you correct the underlying cause instead of chasing symptoms. And this brings us to the final crucial mindset shift. Neuropathy is not a life sentence. It is not random. It is not just bad luck or genetics. It is your body responding to a metabolic environment that overwhelmed it. But once you change that environment, once you create a space where nerves can breathe, heal, and regenerate, The body does what it was designed to do. It repairs. You are not helpless. You are not broken. You're not stuck. The power to change this lies in understanding the cause and reversing the patterns that created it.